Today I wanted to talk to you about post-operative care after the labioplasty procedure. It's really important to take care of the area and be very gentle, and the healing is amazing and you'll be very happy with the results. So what is really important is the hygiene. You really have to make sure the area is nice and clean. So make sure every time you use a restroom, wash the area. So really important is the peri bottle. Go buy a peri bottle for yourself, or you don't have to have the bottle. Just make sure every time you use the bathroom, wash the area with the warm water. Warm soapy water or just a little warm water to cleanse that area. Pat it dry. The area has to be dry at the end. Be very gentle. No pulling, no tugging, because there are going to be stitches, and the stitches are going to be there for about 4 to 6 weeks or so. So pat it dry. At the end of that, use maybe cotton underwear or a pad or some kind of a protective covering between the stitches and your underclothes so they don't stick to it and get pulled or cause any kind of a discomfort. Using very comfortable loose fitting clothes is also very important, so there's no pressure on the stitches, there's no pulling or tugging. The second very important thing is icing. Ice. Really, for first 2 to 3 days, ice is gonna be your friend. It not only will help with the pain, it will also help decrease the inflammation and swelling and enhance the healing. You can ice for 15 minutes on, 15 minutes off, at least 4 to 5 times a day. More the better. So remember to ice it at least for 2 to 3 days, okay? Most of the physicians are gonna give you antibiotics. This is for prevention of any kind of an infection in the labioplasty site. So please remember to take your antibiotics on time. Don't forget them. Finish the course. Some people use local antibiotics. Some people give oral. It depends upon the physician what their choice is. But whichever way it's prescribed to you, please use it. It's really important to rest after the procedure. I would want you to take few days off from work, and when you're resting, try to avoid prolonged sitting, because if you're sitting for a long time, there will be a fluid collection into the labial area, and that will increase the swelling. So if you can lay down, now you don't have to stay laying down all the time, because if you stay in bed all the time, then we start worrying about blood clots. So you still need to walk, move around, but whenever you're resting, make sure that your feet are up and there's not too much of a pressure on the labioplasty site. Now, pain is usually well controlled with the pain medications which are prescribed to you. But the most important one to take is an anti-inflammatory. You can take any form of ibuprofen. It will do 2 things. It will decrease inflammation and swelling, and number 2, it will help with the pain control as well. So take them scheduled at least for a few days after the procedure. Now, we do want you to make sure to use either the Dermaplast or any of those pain sprays as well, which will help with pain control, and it will help in a way that the stitches don't get stuck on the peri pad and they don't get pulled. We want you to look for any signs of infection. Now, there will be swelling, there will be some bruising, and there will be some pain. But excessive swelling, excessive bruising, or excessive bleeding or discharge are not the right signs. They do suggest some kind of a complication. So if you notice any one of those, then please talk to your doctor, contact your doctor. Most of the physicians are gonna see you back in next few days after the procedure to check the site of an infection. So please make that appointment as well. really important for you is to avoid any kind of straining. No heavy lifting, no straining. So if your work involves that, then you're gonna need some kind of a restriction at work. We do not want you to strain because you're constipated. So taking extra fluids and fibers in your diet and avoiding constipation is very, very important. Now the sutures, the stitches are there for 4 to 6 weeks. So we will tell you not to have any sexual intercourse for 6 weeks or so. If you are into workout, you can resume walking and light exercises about 2 to 4 weeks after the procedure, but for heavy lifting like weightlifting, I would wait for at least 6 weeks or so. No soaking in the bathtub or swimming pools. Please avoid that to avoid any infection to the area. If you are interested, you can try sitz baths. They help in getting rid of some of the old cells, pain control, as well as swelling. Labioplasty heals very well. The results are amazing, but it's really important to take care of the surgical side for first 4 to 6 weeks. The healing takes about that much of a time. You have gone through the procedure. You are expecting amazing results, and you're gonna get it. You are gonna get those amazing results as long as you take good care of the labioplasty site.